Hello, dear subscriber. Welcome to part 2 of drug addiction. Today we are doing rehabilitation strategies. Some of the rehabilitation strategies include CBT, detoxification, 12 steps specification, song and dance, interviewing, among others. But generally, we have the 6 common ones. Today, in this particular episode, we'll look at CBT, Cognitive Behavioral Therapy. Under Cognitive Behavioral Therapy, we'll specifically look at restructuring, cognitive restructuring. Cognitive restructuring is whereby you change the mind patterns, you change the behavior patterns of an individual. There is that individual who believes that unless I drink, I will not be happy. You therefore restructure his brain to show him that there are other ways in which you can enjoy. You can enjoy by going for a tour. You can enjoy by singing. You can enjoy by doing so many other things. So we restructure the brain. Although this one is a short-term kind of treatment, because it is just the change of mannerism. The same, it is a short-term, just like the detoxification. Detoxification is one that requires a doctor's assistance. You need the doctor's assistance because some of the withdrawal symptoms are life-threatening. They can kill. So it requires a doctor's recommendation and a doctor's involvement for you to go through it. CBT, it requires the individual plus a therapist, a counselor, but it is short-term. The one that would be long-term would be 12-step specification. For CBT, it is just a pure change of your thinking, such that we work on your negative thoughts and try to make them better. Instead of saying, like somebody could say, instead of saying, I blew the report away, I am totally useless. The person could restructure the brain and say, this was not my best. I can do better. Apart from that, you can do a cognitive restructuring using a journal where you write your everyday worries, your everyday problems. Sometimes you even write it as a letter. That's why we call it journaling. You write yourself a letter. Like you say, Dear Rhoda, how are you? I don't like your behavior since you started drinking. Rhoda, you've changed in the following ways. Then you write down the inventory of how you have changed negative. And you continue writing. Rhoda, I would wish that you change and become a better person. If you become a better person, you will have the following rewards. 1, you will have a stable family. 2, you will have a good investment. 3, you see, as you are writing those positive things, your brain is restructuring from the negative thoughts that I must drink. And you now start focusing your energies towards being nice, towards avoiding alcohol, because you have made an inventory of the nice things it can do and the bad things it can do to you, and the good things of you stopping drinking far outweigh the positives. And so you make a judgment and realize that higher, it is better if I would stop completely drinking. Next time, we're going to look at 12-step verification. 12-step verification will be very long. See you next time. Please remember to subscribe, like, and share.